Question 1. A client with heart failure reports shortness of breath while lying flat. What should the nurse do first? A. Administer oxygen. B. Raise the head of the bed. C. Call the provider. D. Obtain a chest X-ray. Correct answer, B. Raise the head of the bed. Rationale: elevating the head of the bed improves lung expansion and reduces the work of breathing. It is the quickest intervention the nurse can perform to relieve symptoms. Strategy: apply the ABCs. Choose the action that improves breathing immediately. Question 2. A nurse finds a postoperative client with a respiratory rate of 8 per minute. Which action is priority? A. Notify the provider. B. Reposition the client. C. Assess oxygen saturation. D. Administer pain medication. Correct answer, C. Assess oxygen saturation. Rationale: a respiratory rate of 8 per minute may indicate respiratory depression. Oxygen saturation provides important information about the severity of the problem. Strategy: assess before implementing whenever possible. Gather more data before taking further action. Question 3. A client receiving blood suddenly develops chills and back pain. What should the nurse do first? A. Stop the transfusion. B. Slow the infusion. C. Give acetaminophen. D. Notify the provider. Correct answer, A. Stop the transfusion. Rationale: chills and back pain are signs of a possible transfusion reaction. Continuing the transfusion could worsen the client's condition. Strategy: remove the source of harm first. Then assess and follow protocol. Question 4. Which client should the nurse see first? A. BP 150/90 mmHg. B. New confusion. C. Pain score 8 out of 10. D. Temperature 38 degrees Celsius. Correct answer, B. New confusion. Rationale: new confusion is an unexpected finding that may signal a serious problem. It can be an early sign of hypoxia or neurological deterioration. Strategy: prioritize acute changes over expected findings. Unstable clients come before stable clients. Question 5. A client with diabetes is sweating, shaky, and confused. Which action is priority? A. Give insulin. B. Check blood glucose. C. Encourage exercise. D. Restrict carbohydrates. Correct answer, B. Check blood glucose. Rationale: these symptoms are consistent with hypoglycemia. Blood glucose should be checked to confirm the cause before treatment. Strategy: identify the likely problem first. Assessment often comes before intervention on NCLEX. Question 6. A nurse enters a room and finds a client unresponsive. What is the first action? A. Start CPR. B. Call for help. C. Check responsiveness. D. Get the crash cart. Correct answer, C. Check responsiveness. Rationale: the nurse must verify that the client is truly unresponsive. This assessment determines the next emergency steps. Strategy: follow the correct emergency sequence. Assess before activating interventions. Question 7. Which finding requires immediate intervention? A. Potassium 6. 2 milliequivalent/L. B. Sodium 134 milliequivalent/L. C. Calcium 8.8 milligrams per deciliter. D. Magnesium 2.0 milligrams per deciliter. Correct answer, A. Potassium 6.2 milliequivalent/L. Rationale: severe hyperkalemia can lead to dangerous cardiac arrhythmias. This value presents the greatest immediate risk to life. Strategy: focus on the most life-threatening abnormality. Critical potassium levels are always a priority. Question 8. A client with chest pain is prescribed nitroglycerin. Which assessment is priority? A. Temperature. B. Blood pressure. C. Weight. D. Vision. Correct answer, B. Blood pressure. Rationale: nitroglycerin can significantly lower blood pressure. Assessing BP helps prevent severe hypotension. Strategy: think about the medication's major side effect. Assess for safety before administration. Question 9. Which client can the nurse assign to an LPN? A. Newly admitted client. B. Client needing discharge teaching. C. Stable postoperative client. D. Client with chest pain. Correct answer: C. Stable postoperative client. Rationale: stable clients with predictable outcomes are appropriate for LPN care. They do not require extensive assessment or teaching. Strategy: delegate routine and stable care. Keep assessment, teaching, and unstable clients with the RN. Question 10. A nurse accidentally administers the wrong medication. What should the nurse do first? A. Notify the provider. B. Complete an incident report. C. Assess the client. D. Tell the charge nurse. Correct answer: C. Assess the client. Rationale: the nurse must first determine whether the client has been harmed. Client safety takes priority over reporting and documentation. Strategy: in medication error questions, assess the client first. Notifications and paperwork come afterward. Question 11. A client with meningitis is admitted. Which precaution is required? A. Contact. B. Airborne. C. Droplet. D. Protective. Correct answer: C. Droplet. Rationale: bacterial meningitis spreads through respiratory droplets. Droplet precautions help prevent transmission to others. Strategy: learn the major isolation precautions tested on NCLEX. Match the disease to the correct precaution. Question 12. Which finding is most concerning after thyroidectomy? A. Hoarseness. B. Mild pain. C. Restlessness and stridor. D. Temperature 37.5 degrees Celsius. Correct answer: C. Restlessness and stridor. Rationale: stridor suggests airway obstruction, a life-threatening complication. Immediate intervention is required. Strategy: airway problems always take priority. Look for signs of respiratory compromise. Question 13. A nurse is caring for 4 clients. Which should be assessed first? A. Post-op client with pain 6/10. B. COPD client with oxygen saturation 88%. C. Client awaiting discharge. D. Client requesting water. Correct answer: B. COPD client with oxygen saturation 88%. Rationale: low oxygen saturation indicates impaired oxygenation. This poses the greatest immediate risk. Strategy: use ABCs to prioritize care. Breathing problems come before comfort needs. Question 14. Which client is at greatest risk for infection? A. Fracture. B. Neutropenia. C. Hypertension. D. Cataracts. Correct answer: B. Neutropenia. Rationale: neutrophils are essential for fighting infections. A low neutrophil count greatly increases infection risk. Strategy: focus on the body's ability to defend itself. Immunocompromised clients are high priority. Question 15. A client suddenly develops facial drooping and slurred speech. What is priority? A. Check blood glucose. B. Activate stroke protocol. C. Give aspirin. D. Obtain history. Correct answer: B. Activate stroke protocol. Rationale: these are classic signs of a stroke. Rapid treatment can reduce permanent damage. Strategy: recognize emergency conditions quickly. Time-sensitive conditions require immediate action. Question 16. A client with a tracheostomy is coughing and restless. What is the first action? A. Suction the airway. B. Call the provider. C. Increase 4 fluids. D. Administer sedatives. Correct answer: A. Suction the airway. Rationale: restlessness and coughing may indicate airway obstruction. Clearing the airway is the priority. Strategy: always address airway issues first. Choose the intervention that directly improves oxygenation. Question 17. A nurse notes absent bowel sounds after abdominal surgery. What should the nurse do? A. Document findings. B. Give laxatives. C. Encourage food intake. D. Notify provider immediately. Correct answer: A. Document findings. Rationale: temporary absent bowel sounds are expected after abdominal surgery. This is a normal postoperative finding. Strategy: distinguish expected findings from complications. Do not overreact to normal recovery signs. Question 18. Which client should be placed in a private room? A. Pneumonia. B. Tuberculosis. C. Hypertension. D. Diabetes. Correct answer: B. Tuberculosis. Rationale: tuberculosis requires airborne precautions and a negative pressure room. Isolation helps prevent disease spread. Strategy: no high-risk infectious diseases. Airborne illnesses require special precautions. Question 19. A client reports calf pain and swelling. What is priority? A. Massage the leg. B. Encourage ambulation. C. Bed rest and notify provider. D. Apply heat. Correct answer: C. Bed rest and notify provider. Rationale: these symptoms suggest deep vein thrombosis. Movement may increase the risk of embolization. Strategy: avoid interventions that could worsen the condition. Think safety first. Question 20. A client receiving morphine becomes difficult to arouse. Priority action? A. Administer naloxone. B. Increase oxygen flow. C. Reassure family. D. Check temperature. Correct answer: A. Administer naloxone. Rationale: excessive sedation may indicate opioid overdose. Naloxone reverses opioid effects rapidly. Strategy: identify the cause of the problem. Treat life-threatening medication reactions immediately. Question 21. A client in shock has cool, clammy skin. Which assessment is priority? A. Weight. B. Blood pressure. C. Height. D. Vision. Correct answer: B. Blood pressure. Rationale: blood pressure helps determine the severity of shock. It provides important information about circulation. Strategy: in shock questions, focus on circulation. Monitor hemodynamic status closely. Question 22. Which ECG finding requires immediate intervention? A. Ventricular tachycardia. B. Sinus rhythm. C. Sinus bradycardia. D. Premature atrial contractions. Correct answer: A. Ventricular tachycardia. Rationale: ventricular tachycardia can rapidly progress to cardiac arrest. Immediate treatment is necessary. Strategy: recognize lethal cardiac rhythms. Unstable ventricular rhythms are emergencies. Question 23. A client has a seizure. What should the nurse do first after it ends? A. Offer water. B. Ambulate the client. C. Take temperature. D. Assess airway. Correct answer: D. Assess airway. Rationale: airway obstruction can occur after a seizure. Oxygenation must be evaluated immediately. Strategy: think ABCs after any seizure. Airway and breathing come first. Question 24. What is usually the earliest sign of hypoxia? A. Cyanosis. B. Restlessness. C. Bradycardia. D. Hypotension. Correct answer: B. Restlessness. Rationale: restlessness often appears before more severe signs develop. Early recognition helps prevent deterioration. Strategy: learn early versus late signs. NCLEX frequently tests this concept. Question 25. Which client can be discharged first? A. Client with chest pain. B. Client receiving blood. C. Stable postoperative client. D. Client with shortness of breath. Correct answer, C. Stable postoperative client. Rationale: the client is stable and does not require acute monitoring. The others have potentially serious conditions. Strategy: identify the safest client. Stable clients have lower priority. Question 26. A client has facial burns after a house fire. What is priority? A. Airway patency. B. Pain level. C. Weight. D. Diet. Correct answer, A. Airway patency. Rationale: facial burns may indicate inhalation injury. Airway swelling can develop rapidly. Strategy: airway always comes before other concerns. Question 27. A potassium level of 2.8 milliequivalent/L indicates A. Hyperkalemia. B. Hypokalemia. C. Normal level. D. Dehydration. Correct answer, B. Hypokalemia. Rationale: a potassium level of 2.8 milliequivalent/L is below normal. It can increase the risk of cardiac arrhythmias. Strategy: memorize common laboratory ranges. Potassium questions are common on NCLEX. Question 28. Which is the best indicator of kidney perfusion? A. Heart rate. B. Weight. C. Temperature. D. Urine output. Correct answer, D. Urine output. Rationale: adequate urine output reflects effective kidney perfusion. It is a key assessment finding. Strategy: focus on the organ's primary function. Kidneys produce urine. Question 29. Which postpartum finding requires immediate attention? A. Heavy vaginal bleeding. B. Fatigue. C. Mild cramping. D. Hunger. Correct answer, A. Heavy vaginal bleeding. Rationale: excessive bleeding may indicate postpartum hemorrhage. This can become life-threatening quickly. Strategy: prioritize actual threats to life. Excessive bleeding is always urgent. Question 30. A client has a head injury. Which assessment is priority? A. Skin color. B. Appetite. C. Neurological status. D. Hearing. Correct answer, C. Neurological status. Rationale: head injuries can rapidly affect brain function. Frequent neurological assessments are essential. Strategy: assess the body system directly affected by the condition. Question 31. A client receiving blood develops dyspnea. What does this suggest? A. Fluid overload. B. Constipation. C. Anxiety. D. Fever. Correct answer, A. Fluid overload. Rationale: dyspnea is a common sign of circulatory overload. Prompt assessment is required. Strategy: watch for complications during transfusions. Respiratory symptoms are concerning. Question 32. Which client has the highest fall risk? A. Confused elderly client. B. Young adult with headache. C. Stable postoperative client. D. Client with mild fever. Correct answer, A. Confused elderly client. Rationale: confusion increases the likelihood of unsafe behavior. Advanced age adds additional risk. Strategy: consider both mental and physical factors affecting safety. Question 33. A client receives insulin. What should the nurse monitor closely? A. Blood glucose. B. Vision. C. Hearing. D. Height. Correct answer, A. Blood glucose. Rationale: insulin directly affects blood sugar levels. Monitoring helps prevent hypoglycemia. Strategy: link the medication to its primary effect. Question 34. Which finding suggests digoxin toxicity? A. Increased appetite. B. Hypertension. C. Yellow vision. D. Weight gain. Correct answer, C. Yellow vision. Rationale: visual disturbances are classic signs of digoxin toxicity. They often occur with nausea and bradycardia. Strategy: memorize hallmark medication side effects. Question 35. Which pneumonia finding is most concerning? A. Oxygen saturation 84%. B. Mild cough. C. Fatigue. D. Decreased appetite. Correct answer: A. Oxygen saturation 84%. Rationale: severe hypoxemia threatens oxygen delivery to tissues. Immediate intervention is needed. Strategy: prioritize oxygenation problems. Question 36. A client develops anaphylaxis after medication administration. What is priority? A. Acetaminophen. B. Epinephrine. C. Ibuprofen. D. Morphine. Correct answer: B. Epinephrine. Rationale: epinephrine reverses airway swelling and severe allergic reactions. It is the first-line treatment. Strategy: know emergency medications and their uses. Question 37. What is the best indicator that pain medication worked? A. Stable BP. B. Normal pulse. C. Relaxed posture. D. Client reports less pain. Correct answer: D. Client reports less pain. Rationale: pain is subjective and best measured by the client's statement. Self-report is the most reliable indicator. Strategy: trust the client's report when assessing pain. Question 38. Which electrolyte imbalance is most urgent? A. Potassium 6.5 milliequivalent/L. B. Sodium 135 milliequivalent/L. C. Calcium 9 mg per deciliter. D. Magnesium 2 milliequivalent/L. Correct answer: A. Potassium 6.5 milliequivalent/L. Rationale: severe hyperkalemia can cause fatal cardiac arrhythmias. Immediate treatment is necessary. Strategy: high potassium levels are frequently NCLEX priorities. Question 39. During a fire, what is the nurse's first action? A. Extinguish the fire. B. Save equipment. C. Rescue clients. D. Complete paperwork. Correct answer: C. Rescue clients. Rationale: protecting human life is the highest priority. Client safety comes before property. Strategy: remember the race protocol, rescue first. Question 40. Which client should be assessed first? A. Client with nausea. B. Client with sudden chest pain. C. Client requesting food. D. Client awaiting discharge. Correct answer: B. Client with sudden chest pain. Rationale: chest pain may indicate a cardiac emergency. Rapid assessment is essential. Strategy: prioritize potentially life-threatening symptoms. Question 41. What is often the first sign of increased intracranial pressure? A. Change in level of consciousness. B. Fixed pupils. C. Seizures. D. Bradycardia. Correct answer: A. Change in level of consciousness. Rationale: altered consciousness is usually the earliest indicator. Early recognition can improve outcomes. Strategy: learn early and late signs of neurological deterioration. Question 42. Which postoperative finding is most concerning? A. Mild nausea. B. Fatigue. C. Incisional pain. D. Respiratory distress. Correct answer: D. Respiratory distress. Rationale: respiratory distress threatens oxygenation and can become fatal. Immediate intervention is required. Strategy: breathing problems take priority over discomfort. Question 43. A client has a GI bleed. What should the nurse assess first? A. Vital signs. B. Hair color. C. Sleep pattern. D. Appetite. Correct answer: A. Vital signs. Rationale: GI bleeding can lead to shock and hemodynamic instability. Vital signs help determine severity. Strategy, assess circulation when blood loss is suspected. Question 44. Which laboratory result is most critical? A. WBC 8000/mm superscript 3. B. Sodium 138 milliequivalent/L. C. Hemoglobin 6G/DL. D. Platelets 200,000/mm superscript 3. Correct answer, C. Hemoglobin 6G/DL. Rationale, a hemoglobin of 6G/DL indicates severe anemia. Oxygen delivery to tissues may be significantly impaired. Strategy. Identify values that threaten life or organ function. Question 45. A client is diagnosed with pulmonary embolism. What is priority? A. Encourage fluids. B. Administer oxygen. C. Offer food. D. Measure height. Correct answer, B. Administer oxygen. Rationale, pulmonary embolism impairs oxygen exchange. Oxygen therapy helps improve tissue oxygenation. Strategy, address breathing and oxygenation first. Question 46. Which diabetic complication is most urgent? A. Blurred vision. B. Increased thirst. C. Frequent urination. D. Severe hypoglycemia. Correct answer, D. Severe hypoglycemia. Rationale, severe hypoglycemia can cause seizures, coma, and death. Immediate treatment is required. Strategy, prioritize conditions that can rapidly become fatal. Question 47. A client falls from bed. What should the nurse do first? A. Assess the client. B. Notify the provider. C. Complete an incident report. D. Call family. Correct answer, A. Assess the client. Rationale, the nurse must determine whether injury occurred. Assessment guides all further actions. Strategy, client first, paperwork later. Question 48. Which newborn finding is most concerning? A. Sneezing. B. Hiccups. C. Central cyanosis. D. Yawning. Correct answer, C. Central cyanosis. Rationale, central cyanosis suggests inadequate oxygenation. It requires immediate evaluation. Strategy, focus on signs affecting oxygen delivery. Question 49. A client suddenly becomes pulseless. What is the nurse's priority action? A. Check temperature. B. Start CPR. C. Notify family. D. Document findings. Correct answer, B. Start CPR. Rationale, immediate CPR improves the chance of survival. Delays can lead to irreversible damage. Strategy. In cardiac arrest, begin life-saving measures immediately. Question 50. What is the most important NCLEX priority principle? A. Airway, breathing, circulation. B. First come, first served. C. Treat pain first. D. Document first. Correct answer, A. Airway, breathing, circulation. Rationale, ABCs help identify the most life-threatening problems first. They form the foundation of NCLEX prioritization. Strategy, when unsure, choose the option that protects airway, breathing, or circulation.